So my role in Milwaukee County is really twofold. So the longer role that I've had in Milwaukee County is as our medical director for our Office of Emergency Management. And so what that really means is overseeing our EMS systems in Milwaukee County. We have 14 different fire departments. Each of them provide 911 emergency medical services. And so overseeing the care that is provided there. That's 115,000 patient encounters. So it's really a health system of its own. And the more recent role over the last few years is as the Chief Health Policy Advisor to the County Executive. And that's really everything health in the county, not just traditional health services, but also thinking upstream about housing and things like that. I think specific to this job, the challenges are all the different things going on. Are we focusing on motor vehicle collisions? Are we focusing on firearm injuries? Are we focusing on COVID? Are we focusing on housing? Which different thing is it today? But the fact of the matter is they all affect health in different ways, and so they're all important.
I'm a versatile and dedicated social justice advocate, and I am passionate about health equity. So each role that I've had up until this point, I've made it a point to center the needs of those most vulnerable while being a bridge to institutions and communities to help with the distribution of resources and support. I've sought out accountability. And when thinking of accountability, it's assessing the value of needs, effectiveness of programs and policies, and it's thinking of the long-term impact of prioritizing, I would say, outcomes that are related to health based on not just race and ethnicity, but the impact of decision-making that has the history of being race neutral.
I think when we think about health, of course, it's access to high quality and affordable healthcare. That's kind of traditional health, what we think of. But it goes way beyond that. It's about access to sustainable housing. It's about proximity to healthy foods, accessibility to green spaces. And we have to think about each of those different elements as we think about achieving health and achieving health equity.
Well, it all depends on how you define health equity. And for me, my training in public health informs that definition. And it's about the distribution of resources and the acknowledgement of needs. And that varies based on neighborhood, based on the way people identify culturally, and the representation you have districtly speaking, and within leadership. A healthy Milwaukee County looks like, to me, a county that is civically engaged and properly funded. And if it's civically engaged and properly funded, there's higher graduation rates, there's more living wage jobs, there's less uninsured adults and less children in poverty.
Health is not just the Department of Health and Human Services. It's not just the Office of Emergency Management, but it's the county executive's office, it's parks, it's the Department of Transportation. Everybody thinks about health, and not necessarily in the traditional ways you think of. And so it's not just a one-man show, it's not just a one-department show, it's really the entire county working to become healthier.